Okay, welcome back. So our next symposium will be sponsored by Sanofi, and our speaker is Dr. Ahmed Moussa. And the topic is going beyond acute focal inflammation in managing patients with multiple sclerosis. So I'm delighted to welcome our guest speaker, Dr. Ahmed Moussa. He's consultant neurologist and head of neurology department at Saudi German Hospital. He's a well-known speaker in the area and expert in Dubai in particular. So the non-virtual stage is yours, Dr. Ahmed.
Good afternoon, everyone. These are my disclosures. Now, as we know, the two main hallmarks of multiple sclerosis are the acute clinical relapses and the progressive disabilities. The acute relapses is what happens due to the acute focal damage, secondary to the demyelination of the nerve fibers, while the progressive disabilities is what happened due to the neurodegeneration, or what is called the brain smoldering, a terminology that you have heard a couple of times today. Both of these two pathologies will lead to loss of function, whether physical or cognitive. The acute focal inflammation appears clinically as relapses, acute neurological deficits, and manifest in the MRI in the form of acute focal lesions, hyper-intense lesions, whether with contrast or without contrast. While the chronic smoldering manifests clinically as progressive disabilities and appears in the MRI in the form of chronic active lesions and brain volume loss. Obazio, today's topic, has proven its efficacy in reducing the multiple sclerosis relapses, but it has also proven its efficacy in delaying and slowing the neurodegeneration in patients with early MS. Teriflunomide, Obazio, was associated with a greater reduction of the whole brain volume loss versus placebo. The differences were observed as early as 6 months, and the results were maintained throughout the 2 years of the study. The same study, the topic study, have shown also that Obazio is associated with a greater reduction of the median cortical gray matter volume loss versus placebo. Again, the results were evident as early as month 6, and it was maintained throughout the 2 years of the study. We know that the loss of the gray matter is closely correlated to the long-term disability and cognitive worsening. The TEMSO study have showed that the annualized loss in brain volume was significantly slower with the Obazio group compared to the placebo group. The results were evident at year 1 and maintained at year 2. How this is reflected on multiple sclerosis patients, or how this should be reflected on MS patients. It should be reflected on 2 aspects: reduction in the disability worsening and improvement of the cognitive functions. Speaking of the disability worsening, the TEMSO study have shown that Obazio is associated with 30% reduction in the cognitive disability worsening. Similar results were obtained also from the Tower study, where teriflunomide was associated with 36% relative risk reduction in the confirmed disability worsening. These results were also confirmed by the TEMSO extension study. Speaking of the cognitive performance, the TEMSO core study using the PASAT score have shown that Obazio was associated with higher PASAT scores, denoting improvement of the cognitive functions. These are the results of the core study, but the extension study have shown even better results, where patients continued to score higher in the PASAT score in the weeks 156 and 252, denoting much higher improvement in their cognitive functions. The TSQM is a survey questionnaire designed to assess patient satisfaction about medications. It addresses the most important 4 domains in any medicine: global satisfaction, effectiveness, side effects, and convenience. It was conducted among patients who were on Obazio from the beginning at week 4 and week 48. It was also conducted among switchers, those who were receiving other medications, then they shift to Obazio. The patients give Obazio high scores in the 4 domains, especially in the convenience, due to the easily dosing. As we know, Obazio is taken once per day. But more interestingly, the switchers gave Obazio higher scores in the 4 domains compared to their previous medications. This was reflected on the adherence, where 98% of the patient reported more than 80% compliance, and only 11% of the patient discontinued the treatment. The adherence of Obazio was compared to the adherence of dimethyl fumarate and injectables. It was found that the adherence and persistence of Obazio was significantly better than injectables and dimethyl fumarate. It makes sense since injectables are injectables. No one likes injection. And dimethyl fumarate is double the dose of Obazio. Dimethyl fumarate is taken twice, where Obazio is taken once. So it was not a surprise to find that the persistence of Obazio was higher at all time points versus dimethyl fumarate and injectable DMTs. And we know that better adherence will be associated with improved long-term outcomes. The patient-determined disease steps, the PDDS. This is a score given by the patient to himself as an assessment of his own disability. So it is his own perception of his own disability. It is a reflection of the EDSS score, which is a score given to him by his physician. The TherapRo study have shown that the patient perception of disability remained stable throughout the 48 weeks of the study, which was consistent with the stability of their ADSS scores. So the disability did not progress in patients switching to Obazio over the entire TherapRo trial for both physicians or patient-reported measures. Utilizing the French multiple sclerosis registry, clinical outcomes were not significantly different in dimethyl fumarate versus Obazio. Both were as equal as efficacious as each other in preventing multiple sclerosis. The primary endpoint was the proportion of patients with at least one relapse at 1 year post-initiation, with one extra advantage for teriflunomide, which is the easy dosing, being taken once per day. To summarize the efficacy, Obazio have shown significant impact on cortical gray matter atrophy. Treatment with Obazio showed improvements in cognitive functions. The adherence and persistence was significantly better on Obazio compared to dimethyl fumarate and injectables. No significant difference between Obazio and dimethyl fumarate as seen on the traditional and the lesion-based MRI, but on the aspect of the brain volume loss, Obazio was superior than dimethyl fumarate. Obazio mode of action and safety. The mode of action of Obazio simply is inhibition of the proliferation of the autoreactive B lymphocytes and T lymphocytes. Reduced lymphocyte proliferation will lead to reduced migration of the autoreactive lymphocytes through the blood-brain barrier to the CNS, which will lead to reduced inflammation, reduced demyelination, and reduced neurodegeneration. Obazio is one of the safest multiple sclerosis medications. It has never been linked to serious adverse effects. It has never been linked to serious infections. It has never been linked to malignancies. Obazio is supported by 15 years of clinical trial experience, including more than 3,000 patients and more than 6,000 patient years of cumulative exposure. Patients on the Tower study were monitored for safety for up to 6 years, and patients in the TIMSO study were monitored for safety for up to 10 years. The main reason for discontinuation of the medicine was the ALT increase. And although the ALT increase was the main reason for discontinuation of the medicine, the incidence was only 2.6%. And the discontinuation was mainly due to protocol requirements. Other causes for discontinuation of the medicine was the neutropenia, hair thinning, diarrhea, and nausea. For the nausea, the overall incidence was 10%. The diarrhea, the overall incidence was 13%. Most of the cases appeared in the first 3 to 6 months. Cases were mild to moderate and rarely led to discontinuation of the medicine, and the cases recovered spontaneously without corrective medications. The hair thinning, which might form a concern to the patients, the incidence was low. Cases appears only in the first 3 to 6 months, and if it didn't happen in the first 6 months, it won't happen. The cases were not frequent, mild to moderate, and most of the cases resolved without corrective treatment. Speaking of the elevated ALTs, the elevated ALTs were mostly 1 to 3 times the upper limit of normal. The cases appears only in the first 6 months. The severity was mild to moderate, and the values normalized on treatment. Due to the elevated ALTs, it is recommended to check the liver function every 4 weeks during the first 6 months and regularly thereafter. Obazio has not been linked to significant drop in lymphocyte or neutrophilic counts. The pooled core data have shown that the mean lymphocytic count and the mean neutrophilic count has never gone beyond the lower limit of normal, and the decreases were generally no more than 15%. This supports the fact that Obazio is not an immunosuppressant, it is an immunomodulatory, and it justifies the fact why Obazio has not been linked to serious infections. Speaking of infections, the incidence of infection with Obazio was similar for patients with and without lymphopenia. Obazio was not associated with increased risk of infection versus placebo. Most infections were mild to moderate in severity. And more importantly, no single case of PML with Obazio till date. Obazio has also been never linked to malignancies, whether cervix carcinoma, breast cancer, thyroid cancer, benign tumors. There was no evidence of increased risk of malignancy with Obazio. There was no unusual pattern reported regarding malignancy, hematological malignancies, or lymphoproliferative tumors. Obazio and pregnancy. Obazio is a reliable and good option for women in a childbearing period as long as they are on reliable contraception. Obazio, like most of the DMTs, is contraindicated in pregnancy and a reliable contraception is required. But what happened to women who got pregnant accidentally on Obazio? During the clinical studies, 70 cases got pregnant. All of their outcomes were known. In the post-marketing phase, 367 women got pregnant. Out of these 367, 152 cases were monitored and their outcomes was recorded. The cases that were able to track were reported and their outcome were recorded, and the data showed that no increased risk for human teratogenicity in women who inadvertently became pregnant while on Obazio, whether in the clinical or the post-marketing setting. Number two, the pregnancy outcomes, including the risk of spontaneous abortion in Obazio-exposed pregnancies, were consistent with that of the general population. Obazio is the only DMT that can be measured via blood levels, and it is the only MS medicine that can be eliminated successfully from the system. There is no risk for the fetus if the expected plasma concentration of Obazio are less than 0.02 milligram per liter, assessed 2 times at least 14 days apart. Without an accelerated elimination procedure, it takes an average of 8 months to reach this level, the level of 0.02 milligram per liter, although it may take up to 2 years due to individual variation. The estimated female exposure via the semen of a partner treated by Obazio is around 100 times lower than the standard dose of the 14 mg. When do we need to use the accelerated elimination? Well, in cases of unplanned pregnancy, or if the discontinuation of the treatment to be considered. So to summarize, for more than 16 years of clinical trials, for more than 16 years across 4 clinical trials, there is no new or unexpected safety signals have been observed with Obazio. Common adverse effects were mild to moderate, transient, and rarely led to discontinuation of the medicine. No increased risk of serious infection, and no significant impact on immunization, including influenza vaccinations. No confirmed cases of PML to date. Obazio is an option for women in a childbearing period who are on reliable contraception. No increased risk for human teratogenicity in women who inadvertently became pregnant on Obazio. Thank you.
Thank you, Dr. Ahmed, for nice presentation. Any questions, Dr. Ahmed Moussa? Okay, question from me. What about
Thank you.
the male partner? You know, we hear from people, and it's written in drug information
Yes.
that male partner should take precautions to prevent contraception, or to take contraception to avoid pregnancy, that his wife should not get pregnant.
And the data is showing that it is very low exposure from the male to the female. The exposure is 100 times lower than the standard dose. And I don't think that the clinical trials have shown that female patients have got exposure from their male patients.
So males should have normal relation and their wives can get pregnant.
In clinical practice,
During taking Obazio.
yes, in clinical practice, we don't recommend contraception. In your practice, you recommend contraception for patients on Obazio?
No, for males, at the beginning we use, but now no. At the beginning of Obazio.
In the beginning.
But for female, definitely. Any questions? Just a comment, it seems that the safety and efficacy from the real world studies is more than the studies done by the TIMSO and company. It's more effective, more safe than the studies mentioned. This is my experience. We're using it for 6-7 years. Maybe we treated more than 70 patients, and all of them, majority of them are doing.
As we said, Obazio is one of the safest DMT medication. It is not linked to any of the serious adverse effects or serious infections or malignancies.
Thank you.
Thank you all.